How do you determine why you have high cholesterol? In this video, we'll go over cholesterol results and I will talk you through how I think about it and how we can interpret that correctly. As you can see, this particular patient has extremely high cholesterol. Not only her total cholesterol is quite high, but also her particle LDL is very high. Another dangerous factor here is that her small LDL, the most atherogenic LDL, is also extremely high. C-reactive protein, CRP, is also elevated. That number is one of the risk factors for heart attacks and strokes, but it also contributes to elevation of small LDL. As we discussed, it is dangerous part of LDL particles. In addition to that, you can see that her triglycerides are also high. That would be one of the keys in our future interpretation. So when you have high triglycerides, typically it means that patient consumes a lot of carbohydrates. And you can see on this test that LPIR is very high. That is a insulin resistance index. On our next test, insulin level is also high. It's not abnormally high, but it's high normal. And optimally, insulin should be about 5 to 7. And yet, her A1C is completely normal. It is high normal, but she's not even in a pre-diabetes range. So all her changes for insulin resistance happened before she developed diabetes or pre-diabetes. Also, her apolipoprotein B is also elevated, which is another independent factor for heart disease and strokes. But look at her sterols. Sterols basically measure how much fat we absorb through our gut. In this case, her sterols are elevated, so her gut actually absorbs much more cholesterol in her system than in normal situation. So high-fat diet in this case, or ketogenic diet, will profoundly further increase her cholesterol rather than decrease cholesterol. So you have to test it appropriately to figure out what the next step for the patient is. For this patient particularly, we will need to work on her insulin resistance. For other patients, they may need to do a little bit different dietary modifications. Share with others, follow for more, and like this video.